when he heard the rapidity of the decline in this child's health, was that he thought it was very likely that the child had a secondary bacterial infection that was complicating the course of illness. And we do know for any type of influenza, whether it's seasonal influenza or pandemic strain of influenza, this most recent pandemic strain, that bacterial superinfections or secondary infections on top of being infected with this virus can be fatal, can cause severe illness and be fatal. And so that's one possible explanation for why this child died so quickly. And we are still, we have some cultures that we're hoping might give us some additional information on that, some bacterial cultures, but I don't know if those will be helpful or not. We haven't analyzed our Alaska hospitalization rates or cases. We are reporting them on into the Centers for Disease Control, where they're gathering things at a national level. The number of hospitalized cases that we have are very small, and so really we're looking more to the national data to help us know more about that particular group. We do know that young children, adolescent children, and young adults have the highest rates of hospitalization with this particular strain, and it sort of tapers off. And once you get up into your 50s and 60s, the hospitalization rates seem to be lower, which is an interesting trend, and it's not what we usually think of when we think of influenza. But and the highest fatality rates are in the young adult group. I do have some information here. We have some copies of from the CDC that shows some analyses of the mortality and hospitalization data that's been collected nationally so far.
Do you know of those individuals, like how many had just been previously healthy and it was sudden like this?
I haven't analyzed and I can't give you the numbers. We can certainly go back and do that this week. I can say that many of the folks that were hospitalized did have underlying health care problems.
How many deaths in Alaska now are you all counting as being from swine flu?
This would be our second, and this 10-year-old child is our second death.
You're counting the baby?
This is Chris in Fairbanks. Chris Eshelman. The CDC said on its website Friday that Alaska is seeing a higher number of reported cases per capita than all but about 5 states. Do you get indications from the CDC that they're making Alaska priority as they look to distribute vaccines later this fall?
I'm not aware of that report. We have been reporting widespread illness, which I think there's only a handful of states that are reporting it as being widespread. That merely means that we are documenting influenza-like activity in all regions of our state.
Perhaps I misinterpreted the term widespread.
Yeah, it's possible. It's a kind of a nebulous term, but it doesn't mean that we're having more severe disease or more disease, but we are documenting influenza-like illness in all of the regions of our state.
Thank you.
Dr. Funk, Dave Donaldson again. How does this compare, the situation of the widespread disease and also 2 deaths, compare with regular seasonal flu that comes about? Is this harder, worse, faster, or whatever?
I would say, well, it's certainly earlier in the year. We had, and what is different with this particular strain of flu, from my perspective, is that we've had H1N1 influenza, this particular strain, circulating in Alaska and around the country all through the summer. And that, to my knowledge, has not happened previously with regular seasonal influenza. And we have had seasonal flu episodes in the summer. Those of you might remember some cruise ship situations in tourism in the late 90s. But to have this circulating in Alaska, all regions through the summer, it's unique. However, the severity of illness is probably on par with regular seasonal flu. We, 3 years ago, or no, it's probably a little bit more than that now, had a lot of concern, a very bad influenza year. Lots of people were ill, and there was a real concern that our pediatric case mortality was really high. And there were a lot of reports, particularly from Colorado, and we did have one death in a child during that year, at least. So I'd say that we have had flu seasons that are as severe as we're seeing right now, and it's not unheard of with regular seasonal flu.
So if anyone is ill now with what they think is the flu, could you say it's definitely H1N1 and not seasonal flu because that's not showing up yet in Alaska?
Yeah, the question is, if somebody gets influenza illness and is diagnosed with the flu, can we assume it's H1N1 or swine flu? Right now, and through the summer, we have been telling healthcare providers that if they do a rapid flu test for influenza A, that's the bedside test or the test that can come back while you're still there in the doctor's office or in the clinic. If that comes back positive, then you can assume it's H1N1 influenza, because that's the only thing that is circulating right now from the cultures that our virology lab is testing. At this point, we hear from the World Health Organization and the CDC that H1N1 strain is the predominant strain circulating in the Northern Hemisphere, and they predict it will be the predominant strain through this flu season, but we just don't know. So what we want to do, in addition to the rapid bedside testing and the PCR testing, is also continue to get samples of that we can grow in the virology laboratory so that we can know a little bit more about which flu strains will be circulating through the fall and winter.
This is Chris Eshelman again in Fairbanks. Can you touch again on the second child that you learned had been transferred to Anchorage with swine flu-like symptoms as well? You said the child had a rapid test and is now doing well. Is that right?
That's right. Do you want to speak to that at all, or do you have more information?
Perhaps you could talk about where that child is now?
I'm going to let Dr. Monsager speak to that. You might want to let them know who you are.
I'm Dr. Monsager. I'm the administrator of Providence Alaska Medical Center, and I've been the director of the Children's Hospital of Providence until very recently. That child came down, as Dr. Funk said, a few days ago, and was initially sick and is now recovering, but is still hospitalized at Providence as of last night. I didn't check this morning.
Has anyone spoken to the family? I mean, can anyone give us any kind of indication of the family, where they are, how they're doing?
I personally have not spoken with the family. However, before we released the press information yesterday, the family was contacted, and they are aware that that information is coming out, that there are no identifying information. The rest of the family is doing well, and that's about all I really want to say on that.
But no one else in the family is sick in any way?
We haven't had no other serious illnesses associated with this contacts around this particular child.
How concerned should people be in general? I mean, we have a press conference talking about this disease for one person who's died. It's alarming just to look at it. How concerned should people be about the H1N1 virus?
Well, I continue to stress the fact that we look to the World Health Organization and the Centers for Disease Control to help us know about this virus and whether it's becoming more what we call virulent or more severe an infectious agent than seasonal influenza. That's kind of our baseline. And all indications right now are that this H1N1 strain has not mutated and has not become a more severe strain that might make you worried a little bit more like the 1918 strain or the avian influenza that we have been worrying about previous years.